The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Big topic, hot topic. We're breaking it here. It's a first on The Wellness Hour, CoolSculpting. This new technology may replace liposuction for the right candidate. You actually cool the fat, almost freeze it, kills the fat cells, and the fat melts off your body or is eliminated from the body. With us, we have a board-certified dermatologist that is getting amazing results with this new technology, Dr. Ed Becker. Dr. Becker, welcome to the program.
Nice to see you, Randy.
All right, now, before we get into this topic with CoolSculpting, I know it took you a long time for you to finally decide to get it. And I told you on the phone, I'm very skeptical. I heard about a friend that had this done. And I said, that sounds like the biggest gimmick in the world. And you told me it actually works. So we'll talk about it. Now, for people that don't know you and your practice, tell me a little bit about your practice in Walnut Creek.
Well, we have a big, busy dermatology practice in Walnut Creek in central Contra Costa County. I'm very lucky. I work in a wonderful area with wonderful people. And
you say you have the best
patients.
job in the world. I mean, you actually love being a dermatologist. Tell me about that.
I think I have the best job in America. I mean,
you really do. You really believe that?
I have the best job.
Okay.
Every day I come to work and I help people with their medical problems and their cosmetic problems. I help people feel better, look better, and it's very gratifying to see the changes that you can have in people's lives with little things. The skin is so visible that people often are much more affected by something on their skin than they are some internal organ problem, which is often much more serious.
Okay.
It prevents them from sometimes being really out in the world. It helps it hurts their self-esteem, their self-image, because it's so visible. And we can make a lot of these things go away.
So moving on to CoolSculpting, okay? At the top of the show I said it freezes the fat or almost freezes the fat, kills the fat cells, and then the body eliminates it. Is that basically how it works?
Well, the technology was developed relatively recently, but it comes from two observations. One was in the 1970s, a report of kids eating popsicles would lose fat in their cheeks. Now they're children, so fat cells are continuing to develop as you're a child, so the fat came back. They weren't left with depressions in their cheeks. I have dimples. I didn't get them from eating popsicles when I was a kid. Okay. I didn't get them from sleeping on buttons either. The other observation is everybody sees this every day. You put butter in the refrigerator, it turns hard in the refrigerator and water stays liquid. You make a sauce or a soup. The fat layers out on the top, it gets hard, the soup or the sauce stays liquid underneath. So this brilliant research dermatologist at Harvard University.
So dermatologists invented this, CoolSculpting.
He took these two ideas together, the reports of this popsicle planiculitis, the loss of fat from exposure to cold, and the observation that fat freezes at a higher temperature than water, and developed a machine that uses suction to pull the fat into this cup that's lined by two plates that chill the tissue in between. Now the temperature.
So it like grabs the fat, for example, like on the abdomen, and then it almost freezes.
It'll grab the fat with suction, pull it into this cup. The cup is lined by these two metal plates that chill the fat and tissue inside those plates. Now everything that's inside those plates, 2 to 3 days, the applicator is on for 1 hour.
Okay.
Followed by a short little massage. Afterwards, this triggers, this freezing of the fat cells leads to crystallization of the lipids within the cell, which triggers a cell process called apoptosis. And this is a
cell death, right?
It's self-regulation of the cell causing self-death, because it's abnormal to have these lipid crystals in the cell. The cell recognizes something's not right, the cell dies over a 2 to 3 day period of time. Then over a 2 to 4 month period of time, the cells break down, the lipids get taken away, they've measured cholesterol, triglycerides, liver function tests. There's no change in anything, but 20 to 25% of the fat cells will die in 2 to 3 days, and over 2 to 4 months, that fat layer starts compressing and collapsing on itself.
So those fat cells are gone. Like liposuction, rather than removing it, you're killing the fat cells in the body. Is that right?
That's right. The fat cells are gone. As an adult, you have all the fat cells you'll ever have. You gain weight, you lose weight, the fat cells get bigger and smaller. So
Is that right?
in a
Okay.
localized area where we use the CoolSculpting, those fat cells will be permanently gone.
You did this on yourself. I mean, tell me about that.
Well, I was very skeptical about this technology. I heard about it several times.
Because you're a pretty lean guy, by the way.
Yeah, I
You work
exercise
out,
5-6 days a week. I'm on my normal body weight, but I had these little localized bulges of fat on my flanks,
Like love
on
handles.
my love handles.
Okay.
That, I mean, for me to lose that, I would have to be gaunt. I'd have to almost be anorexic.
Okay.
And I like to eat too much. I just have lucky genetics or very fast metabolism, so I don't really gain weight. But I could not lose the fat there. And I said, I'm going to try it on one side.
All right.
So I'm a little lopsided now because I did this
Is that right?
2.5 months ago. And the procedure was very simple.
Your wife has done the procedure.
My wife has done the procedure as well.
So you love this. I mean, you think this may be the future or the most popular procedure. I'm going to quote you, in the next 2 years, in 2 years from now, maybe the hottest, most popular procedure in cosmetic surgery or cosmetic
for
procedures.
the right patient, for the person who has little bumps and bulges of fat that are resistant to diet and exercise, if they're in good shape, they eat well, they're within 10-20% of their ideal body weight, a 1-hour in-office procedure per area can reduce that amount of fat by 20-25% or more.
It's inexpensive, by the way. I mean, a lot less.
A lot less expensive than
Like
liposuction.
a fifth of the cost of liposuction.
One of the other big factors, there's no surgery, there's no anesthesia, there's no cutting, there's no downtime. You know, I had the procedure, I went and exercised the next day.
When are you going to do the other side? So you're lopsided right now.
I'm probably not going to do the other side because I want to be reminded every day when I look in the mirror that
You are kidding me.
This really does work.
So you're going to stay a little bit lopsided.
My wife loves me the way I am, lopsided or not.
Okay, so you did that side. So what? Let's talk a little bit about. And by the way, Harvard guy puts this procedure, because I interrupted you, puts this this technology together.
So he took these two.
You knew of him already, you said, because you were skeptical.
Yeah. One of the things that got me more interested in this was the doctor who was one of the developers of it. He developed laser hair removal, laser resurfacing, another procedure called photodynamic therapy, all three of which we use in the office, all three of which work.
Okay.
And he owns nothing of the company. He just developed the technology and gave it away. He's a professor at a university, and he doesn't own anything in the company.
All right.
And so he's a very credible guy. The other thing that happened was I was at a conference, and I was talking to another dermatologist from New York, and we were talking about the procedures we like, the things that we really...
Is this what dermatologists talk about when nobody's around?
We talked about what we do and what works and what our patients like and what our favorite things are. And she said, this was maybe 6 months to a year ago, she said, the greatest thing I ever did was this Zeltique.
And Zeltique is the CoolSculpting that we're talking about.
Zeltique is the company
that freezes the fat.
That manufactures the CoolSculpting machine. So she pulls up her shirt and she shows me a totally flat abdomen. She said, 6 months ago, I had a big bulge here. Said,
this is a dermatologist at a meeting.
And she just said, this is like the best thing that I do in my practice right now.
Really?
So I heard that and I saw the result. I know the guy who's the developer of it, and I thought, well, a leap of faith, I'm going to get the machine, because they don't let you get the machine.
Because these aren't cheap machines.
No, and they don't let you take it and try it. So I got the
leap
machine,
of faith, okay.
And I said, okay, before I can start treating patients, I've got to treat myself, treat my staff, treat some friends, family members, and see, does it work? And if it doesn't work, unfortunately in the past I once made a technology mistake. I bought a laser. It didn't work. That's my problem, my loss.
So you're worried about this being the same thing?
There were so many other technologies, machines that have come out to reduce fat and to reduce cellulite that haven't performed, that haven't worked, that I was very skeptical. But the science behind this is so good, and the people behind it are so good that, the science made sense, and I just took a chance. Now, having been doing the procedure, the results are beyond what I ever would have imagined.
Your staff is happy?
The staff is ecstatic. The thing that happens, you treat one area, and that area gets better, and they come back, well, can you treat over here now and over here now? One of the staff members, we treated her lower abdomen, which was stuck out.
So lower, around the belly button area is one area, and then the love handle's another.
Well, the abdomen can be more than one area. So one staff member, we treated the lower abdomen because that was sticking out more. Now, her upper abdomen sticks out more than the lower abdomen, so that's when we gotta do the upper abdomen so that both will be flat. But also she says, well, now I want to do my love handles. We did some other staff members.
I mean, it takes an hour to do.
It's 1 hour per site, and it's very important that the person is the right candidate, and the right candidate is someone who is, again, in reasonably good shape.
So it's not a heavy person.
A big heavy person is going to be someone who's going to need liposuction.
Because they may get lumps, because it's going to kill the fat and leave them a block of...
Well, the only thing that gets
air?
treated is what gets inside this applicator. So localized bumps and bulges are ideal. Best patients, the people who are coming to see me about this, women after pregnancy. You know, they want to have their body back that they had before. They're uncomfortable with this little bulge. They love their children. They would never change that, but they sure would like to have the body they had before they were pregnant. So this little bulge in the lower abdomen. This is the perfect candidate. Another
Does it leave smooth results? I mean, are you seeing smooth?
Very smooth results. And this also can work in patients who've had liposuction and have uneven, wavy results to smooth out those results. Then another big group of patients, women post-menopause. Very hard for women after menopause to lose weight or to really lose fat. And to do that, both these groups of women would need to become almost emaciated to lose these localized bumps and bulges of fat on their flanks, the abdomen, the back, the inner thighs.
Now, my circle of friends, knowing you were coming here, I said that, you know, and if you're just tuning in, we're talking about this CoolSculpting, which freezes the fat, or almost freezes the fat, kills the fat cells, and then the body eliminates over time these fat cells that will never come back. It's like liposuction. I guess you could either cut fat out, suck it out, or freeze it out. Is that true?
That's true. And it's freezing the fat, but not freezing the tissue. So the temperature.
Yeah, that's a good question. I was going to ask you that.
Because if you froze all the tissue, if water froze, you would cause a severe injury to the skin. So they've developed this to be at a specific temperature.
It's a secret temperature, is that true?
It's a secret temperature. They won't let us know. We know it's it's above
like
the temperature water freezes and below the temperature that fat freezes, but the exact temperature is a company secret.
But I was saying, you know, that knowing that you were coming in today, I know a person, she's running 10 miles a week, she's exercising like crazy, she is at her ideal weight, but she's got this area around the belly button that's driving her crazy. And she says, I'd have to be a skeleton in order to hit this. Yeah. Is that who you want to see?
She is the perfect candidate for CoolSculpting because she's got a localized area of fat, she exercises, she's in good shape, and for her to lose that fat, right, she would have to become anorexic, become a skeleton, and her face would become thin, her arms would become thin, her breasts might get smaller, lots of things would happen, plus she wouldn't be able to eat the things she wants to eat.
Okay.
So you can take somebody and in a short period of time transform something that's been bothering them for years.
You say this is a lot about self-esteem.
So it's
Tell me about that.
A lot of patients will wear very loose-fitting clothing. They'll wear a sweater, or they won't. A man won't tuck a shirt in. Women will wear very loose-fitting clothing. They won't wear a tight-fitting outfit because these bulges stick out. Well, we can flatten those bulges or reduce those bulges. It may take more than one treatment. Each treatment statistically will reduce the amount of fat 22 to 25%.
Okay.
For some patients, that's all that they need. But if they want more, they can come back, and every single time this treatment is done, they'll get a reproducible 25% reduction of the amount of fat each time.
But you had somebody that works with you, one of your employees, that was going to get liposuction.
Yes.
And was able to not get liposuction and got some pretty dramatic results. Let's take a look at those photos.
Well, now you can look at these photos of the before and the after picture. In the before picture, you can see this bulge in the abdomen sticking out, hanging over the pants. So she has a 6-year-old son and was ready to have liposuction because clothes didn't fit right. There was this little bulge in her stomach. She wasn't comfortable with it. And since we had this new technology, we asked for volunteers. She said,
I mean, everybody must have volunteered, though, right? For the whole office, I'll take it.
Everybody wanted to do it.
Okay.
So she did this, and two and a half months later, she won't need any liposuction.
Okay, but this is 1 hour treatment.
It's a 1 hour treatment.
Let me take a look at this.
Now you can imagine how she feels wearing a tight-fitting dress. Her pant size has gone down. Every patient we've treated, their pant size is less than it was before. Their dress size is less than it was before. The skin is smoother. But she now is not going to have a surgical procedure That would mean she'd miss a couple of weeks from work, have unknown potential complications. So for the right patient, CoolSculpting is an incredible
Yeah, but if I'm
procedure.
working in an office with you, okay, I'm going to want to do more. So is she scheduled? Is she going to do more? Are they begging for more treatments? Because after one treatment?
Yeah. Well, now she wants to do the love handles.
Okay.
And everybody who's had a treatment wants to have more treatments. And when we have time, they're going to get more treatments.
Okay, so tell me about this. Okay, so when they go in, you did the whatever you can grab onto. Is that right? How it works? This machine.
You have to have a pinchable amount of fat, and when you have a pinchable amount of localized fat, the machine pulls that fat into the applicator, where it then gets chilled, cooled.
It must hurt a little bit.
The suction is a little bit uncomfortable. Then it gets very, very cold, and it almost feels like a little bit of a burn. 10 minutes later, you're completely numb.
You're numb.
The last 50 minutes, you feel nothing.
So pain is not something they're complaining about afterwards?
No.
Okay.
Now, when I did my love handle, it was a non-event. There was nothing happened. I got a bruise. The skin was a little bit numb for about a month until it got back to normal. The abdomen, there's a little bit more discomfort because it's been a procedure. There's a lot of inflammation. So initially what happens is there's swelling. And a lot of the patients say, gee, I'm bigger than I was before.
But that's just like the next couple of days.
Yeah, it lasts about a week, 2 weeks. About 2 weeks out, they come, oh, it's starting to work. And I tell them, no, it's not starting to work yet. You don't see the results. What you're seeing is the swelling you had from the initial treatment has now gone down. You're now back to where you were before, but you're remembering where you were the week before. Around 4 weeks, they start to see a flattening of the fat. At 2 months, you get about 50–60% of the result.
And for people just tuning in, we're talking about CoolSculpting, an alternative, and may even, in this case, she was going to get liposuction, ideal candidate. That it takes a couple of months because they do it. It kills those fat cells, okay? And then over the next couple of months, the body just eliminates those fat cells.
Yeah,
And I have that right? Is that right?
You have that right. The fat cells, 2 to 3 days after the treatment, the fat cells will die. They break down, dissolve, and the whole layer of fat starts over a couple of months collapsing and reorganizing and being much flatter. Well, if you look at the after picture, you can see that the whole abdomen looks younger. It's much smoother rather than
Good point.
bumpy.
So she still had a little bit of stretch marks, but it just flattens it out.
Yeah,
and it seems to be very smooth because when I look at lipo photos, you see some bumps and things like that.
Now, the results of CoolSculpting are very smooth. It's not going to change the skin. So the stretch marks that were there before are still there. That's not going to change. Everything that's changing is under the surface because the temperature that we're freezing or we're chilling the fat at has no effect on the overlying skin. It's only affecting the fat cells.
So very few people in your area have this. Is that right? Few doctors?
Yeah, that's true. There's a tremendous amount of skepticism, and you have to see it at work to really believe it. And as I said, I was very skeptical. Now, I've gone from skeptic to true believer.
Because you've done it on yourself.
I've done it on myself.
Your
I've done
wife,
it on my
your
wife.
staff.
I've done it on staff and friends. The procedure really does work.
And I told you, I said, I want to look at these results because I can't imagine that they would be dramatic. But after one hour treatment, and those fat cells are dead. I mean, they're gone.
Those fat cells are gone. They're never going to come back. If she's to gain weight again, the fat cells everywhere would get bigger. But since there are fewer fat cells in her abdomen, the abdomen will get much less increased in size than any place else.
So is the flank area, the love handle area, that muffin top, you do one side at a time?
No, you do one side, and an hour later you do the second side. I'm the only person I've only done one side on. No one wants to be lopsided.
My limited time of getting to know you here today, it's part of your personality. You want to be lopsided, you say, as a reminder that this actually works.
Yeah. I want to have unmistakable proof that this works. I'm probably going to do the love handle again because there's the front of the love handle and the back of the love handle. So I'm going to do, I did the front part, which was the bigger bulge. I'm going to do the back. So I'll be completely smooth on this side, which will really be a even more noticeable contrast than it is right now.
You'll be able to, just like, and earlier in this interview you said what motivated you was you're at a dermatology meeting and one of your friends or colleagues picked up their shirt to show you that this CoolSculpting actually works. So you want to be able to do that someday.
I want to be able to do that and show one side versus the other side, the difference.
I'm sure the local news and national news might even really like this, kind of...
Lopsided dermatologist. The other thing that happens with this, that I see, people come back and they've lost this bulge or bump of fat, and now, because of that, They're starting to exercise more.
Oh.
They're starting to diet. So they're going to get even a better result. They're going to lose fat everywhere. Because
so they get motivated.
They get motivated. They see this change in their body, starting feeling better about themselves, have, the self-consciousness they had in clothing, the insecurity they had about these bumps and bulges is gone away. So they're wearing different clothes, and they're now motivated.
So they feel sexy again.
They feel sexier again, okay. and they're dieting, so they're even going to get thinner.
Well, this is sizzling hot. I mean, this is one of those things that everybody's going to be talking about. Yeah. CoolSculpting.
Most people have never even heard of CoolSculpting. So there's this enormous population of potential patients that could benefit from this, who are at home, wearing loose-fitting clothes, men not tucking their shirts in, afraid to go out and, or wear a two-piece bathing suit, who are going to find out about this technology.
Has it been women mostly so far, by the way?
Mostly women, but some men. But it's
so
mostly
the men
women.
find out real men are coming in for this?
Real men. Real men are coming in.
Cowboys are come walking in. But so all around the body, so the back fat, upper back fat, abdomen, and it's safe. We haven't talked about safety.
Yeah, it's completely safe. They've done studies and they've measured blood levels of your cholesterol, triglycerides, liver function tests. There's no change in anything. It's a very slow, gradual process, so you don't see any changes in any of your blood studies. And it's, as I said, my treatment, it was like a non-event. I forgot it. Other than seeing a bruise and being a little numb, I kind of forgot I even had it done. It didn't affect my life at all. I did everything I normally would do. Everybody had treated, they were back at work the next, we did it on a Friday, everybody was working on Monday.
So the collection of before and after photos is just going to grow and grow and grow over time.
Absolutely.
And so this is the future then. I mean, this may have a huge impact on the liposuction crowd.
I think that for the right patient with localized areas of fat that's resistant to diet and exercise, this is the treatment of the present, not just the future. This is the treatment of the present. People with large areas of fat or lots of fat, this is not a treatment.
They still should get maybe liposuction or diet and exercise, etc.
Now, after the liposuction, which doesn't always end up being smooth, there may be some little bumps and bulges because the liposuction didn't turn out perfectly smooth. They can always have this treatment afterwards as a secondary treatment following liposuction.
What's the number one misconception about this procedure that's out there right now? That it doesn't work?
That it doesn't work. It sounds too good to be true, and most of the time when something is too good to be true, it's not true. Because when someone tells you you can go to a doctor's office for 1 hour, get 25% of your fat removed with no surgery, no cutting, no anesthesia, no downtime, walk out and go exercise, and 3-4 months later, 25% of that fat's going to be gone, and that bulge is going to be flatter. That sounds too good to be true. It doesn't seem possible.
You yourself didn't believe it?
I did not believe it. But now I'm
So this will
proof.
become mainstream. And right now, amongst the people that are using this, and I've interviewed other people, knowing I was going to interview you, and they say it works. It's fantastic. I mean, I'm hearing nothing but good things about it. The only negative things I'm hearing about it are for people that don't have it.
Because they
don't
know.
believe it works.
Well, because they don't know. They haven't used the technology to see that it works.
And what I like about you, and for people just tuning in, we're talking about CoolSculpting. It's a new technology, really, brand new technology that freezes the fat, or almost freezes the fat in localized area, kills the fat cells, and your body eliminates the fat. Board-certified dermatologist right here, very skeptical. A Harvard, I guess one of the Harvard professor is behind this technology, and it's working. And there's limited doctors nationwide that actually have this. You were one of these early adopters.
Yeah, I'm an early adopter based on who's behind it, and now because I'm seeing the results. The other thing that I see with this is that patients come back and they say they're much more comfortable in their bodies. And some of these were women who...
That's a good point. Good.
They're relatively thin, in good shape, but they were uncomfortable with just a little bump or bulge, which most people wouldn't see, or if they wore tight clothing, you would see it. Now they say, I just feel more comfortable in my own body. I'm not self-conscious. With my husband,
That's nice.
The husband sees me now, I feel perfectly fine.
So age doesn't matter. I mean, you can do this at 60, 65.
The only...
For leaner people, but that have fat.
You can do it at any age. I think the oldest person who had it done was in their 80s.
Oh, my goodness.
The one thing that it doesn't do is if there's a lot of loose skin, it doesn't change the skin.
But it does get rid of the fat.
It gets rid of the fat. You saw the pictures with the stretch marks. It doesn't change the stretch marks. But the fat goes away.
Well, we're out of time. Final message, though. Somebody watching this, they're skeptical, but they've got these, a lump or a bump that's driving them crazy, as you say.
If you have a bulge of fat in a localized area that you're uncomfortable about, that makes you wear different clothes than you want to wear, or you're self-conscious about, come in, have a consult. I'll let you know, are you a candidate or not. If you have a localized area of fat, you're going to be a candidate, and you'll be very happy with the results.
Okay, now with you say that you have a reputation where people will call you, past patients, people you've been treating for your traditional medical dermatology practice, and they'll say, "Tell me the truth. Does this work?" Yeah. I mean, you hear that.
Yeah. Patients come to me because they know I'll tell them the truth, and now that I've done it and I see the results, I believe this technology does work. It is better than I even imagined it would be.
Is that right? Well, good for you. And so we'll have this interview that'll be available also on your website for people to watch again. We'll give you a clip. So I want to thank you again for coming on the show. Very interesting. You've been watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, you can go to our website at wellnesshour.com, put in Dr. Becker or put in CoolSculpting, and you'll find it there. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.